succeed such a good rank through FET. So tell me more about yourself first, and then tell me about your story. What was your strategy, and when you decided to do the exam, and how did you prepare? So over to you, Dr. Devyani.
First of all, ma'am, I would like to thank you from bottom of my heart to you have guided me, and whatever I have been able to do, it is you have a huge contribution in making me this capable of doing this. And I've done my MBBS from Maulana Azad Medical College, and I've done my MS from Kasturba Hospital, Delhi. And I started following your lectures.
When did you clear the exam, the postgraduate exam?
In 2021, August 2020.
Okay, so just now you cleared the exam.
Yes, ma'am.
Wonderful. And then when did you decide that you have to do fellowship in reproductive medicine?
Actually, ma'am, from the very beginning, reproductive endocrinology and reproductive medicine was a very interesting topic to me. So I was quite interested, and I had an inclination of pursuing a career forward. So I started following your lectures from the beginning of my third year. So these lectures, yes, ma'am, they not only helped me in my preparation of my university exams. So I started preparing simultaneously for both the exams. So
that is so good. That is such a good tip you have given. Start from third year itself. When you're preparing for a theory exam, at the same time, if you start preparing for these entrance exams also, it will be so helpful. Just like we used to do it in MBBS times, and the final year only start preparing for PG. So yes, that's how you did. You start preparing before the third year exam itself. That's wonderful.
Yes.
More about it. So you decided even before the postgraduate exam that you're going to do some super specialty in reproductive medicine and endocrinology. That's wonderful. So you had joined the course in which month, doctor?
Ma'am, actually, I was following your lectures from Speed. So
okay, you started there. So that was long back.
Yes, ma'am. So but then later on, when I got to know that you have a separate subscription as well, so I when my Speed subscription expired, so I took Reproneed subscription in November in 2021.
Okay, 21 November you took Reproneed. And so you were preparing all through before your PG exam itself. So tell me one important question. What was your style of reading? Did you read the big books, Speroff, Gardner's and Williams and all, or were you just focused to whatever, guidelines and class notes and class videos? So what was your way of preparing?
So, ma'am, actually, I used to reading the standard books is very important. So I used to read all the standard books, especially the important chapters like PCOS and hirsutism, the chapters which are very, important for exam point of view.
Right.
Yeah.
So it comes out of interest only. Someone who is interested in reproductive medicine, it's rare to find a person who's not read Speroff. It's after reading Speroff only you realize that you love this subject.
Yes, ma'am.
Isn't it? So you had read Speroff. Any other big books that you have read?
No, ma'am. I had read Speroff and I had read Novak's and Williams obstetrics.
So you were the kind of students who goes with big books, reading big books, getting your basics cleared. And then it becomes easier to follow any class notes and guidelines.
Yeah, but ma'am, when I attend these lectures, so, in the first reading, it's very difficult to understand the text. So if you go through these lectures and if someone orients you, it is when you read it the second time, it becomes very easy.
It becomes easier. And especially all the notes that I have created are either from one of the standard textbooks or from the guidelines. So you can, whatever I have been teaching, you will be able to read somewhere. It's not my own points that I, blabber before all of you. So I make it a point that it should be taken from somewhere. It should be from a, valid source that I have to teach you. So it's nice that my teachings helped you in reading those books.
Yes.
So especially for reproductive medicine and obstetrics, what were your sources of reading? Where did you read from?
In obstetrics, I read Williams Obstetrics. And I also had referred to other Indian books like Ayan Donal, and I also read Datta for a few topics. And I had read all the guidelines that, like ACOG, I downloaded all the ACOG bulletins and RCOG bulletins and all the recent whatever were mentioned in the class. I used to download them and I used to go through them. So
for OBGY, Williams is an easier book compared to Spirop. You can finish it faster.
yes,
And plus the guidelines. That's sufficient for obstetrics. And for reproductive medicine part, what was your source?
For reproductive medicine, I mainly read the notes because Sparrow actually is a very time-consuming book. It takes time to read the books.
And plus, you have to remember all those things. To be
Yes,
able to recollect, you have to make 2-3 revisions before the exam. So that becomes difficult.
Yes, ma'am. In the end, I don't think I was able to remember everything, but the notes had helped me a lot. Like whatever was there in the text, it was arranged in a good way in the notes. So I could grasp them, and it helped me a lot while solving the MCQs.
So it's wonderful. It's commendable on your part too, to be able to, the notes are, vast. I have taken more than a year to complete the notes. And then somebody tells me that in 3 months, they were able to finish all the notes. So that's also very appreciable that you were able to read, understand, and memorize, and then recollect and, perform so well in the exam. So congratulations on that. Also, you're a brilliant student. Before PG itself, you started preparing. So that's the most ideal way of preparing. That's why I've started the foundation course, so that students start preparing even before the exit exams. So one more question, the last question. What was your strategy in the exam? Since it's a negative marking question, how many you attempted and how did you decide which all questions to leave?
Ma'am, I had left 5 questions. I attempted
That's pretty standard. This is what toppers have been telling me. 2 to 7 is the average, and most of them have left only 5 questions. So you left 5 questions, and how did you decide that you have to leave those questions?
Ma'am, those were the questions which I had no idea of. Like there were some questions that I could, solve them by, excluding the other options.
Okay.
So the question which I haven't exactly read, it is not a direct question, but I could exclude the other option. Okay. These were questions which I had no idea of. So,
those were the ones that you left. Yes. So this is also very, very standard that you should attempt at least 95 questions and you should leave only those questions where you don't know anything about. If you are able to rule out 2 options, you're definitely going to mark the question. So from all the interviews, 10-15 interviews that I've taken till date, the strategy is so similar for all the toppers. They're all disciplined, they're all determined, they are consistent, and 50% have read the big books and 50% have not read the big books. So this is the factor which doesn't matter, is what I have derived from all the interviews. Whether you read a book or you don't, the last 3-4 months have to be focused, you have to be very determined, and you have to keep on revising. You should make sure that you will be able to recollect in the exam whatever you're reading. Did you make your own notes, or it was just the class notes from the app or website?
I made my whatever your notes were, I wrote it down in my own handwriting, because I cannot grasp what is printed or what is photo stated. I can only revise things, and the last one was my own handwriting.
That's also, I think 90-95% of the students are saying that they have made their own handwritten notes. So this I keep repeating, there are no shortcuts to success in exam. Through the notes, you will not be able to, the notes are very complete, but you have to convert it into your language, which you understand, your way of writing, your way of underlining. So writing your own notes is very important, which I think barring a few, all of the toppers have written their own notes and in the end revised from the own notes. Right. So that's the way you did, Dr. Devyani.
Also, ma'am, I'm not a kind of person who can cram very easily. So it really helps me if someone makes me understand the whole process. If someone explains the whole process in a detailed way. So I'm really thankful to you that you, explained, you teach in a way that you clear the concepts. So I'm really thankful that you take out all the effort and explain all the mechanisms and tell me why is it so. Like usually how usually 80% people in medical profession, they teach like this is a fact and you have to learn it. So,
right. And I try to make the concepts clearer, because that is how I used to read. Unless a line is clarified, unless I know why this is so, it was difficult for me to remember. I'm the kind of students who will never be able to crack an exam in 3 months. I take 2 years to read the same thing, which talented people like you would finish in 3 months, because I go so much behind why this is so and why this is not like that. Without that, I'll not be able to memorize. So that's a drawback that I had. And because of the drawback only, I'm able to teach, because I was so stubborn and not being able to memorize if I don't understand. So that's how it has been helpful to teach you all, so that you don't take 2 years to understand and then memorize. So at least that part I've done for you. You understand that now, and then it becomes easier. So again, there are two kinds of students. Some students really don't need to understand the concepts to be able to memorize and get good ranks, and some students have to understand to be able to memorize. So you're one of those who needs to understand before you can mug anything. So that's nice. It was very nice talking with you. We'll definitely stay in touch, Dr. Devyani. One small tip if you want to give to students.
What I tell all my juniors and who talk to me is that you should always start early. If you have the plan in your mind, if you prepare well in the beginning, so it is, you have a good chance of success. Like last.
You said you start early. I have seen students who start from second year of their post-graduation, but 6 months after their deciding to prepare, they somehow lose interest. So it's commendable on your part that you decided before the post-graduation exam. For the whole 1 year, you took the exam, and even after that, you did not lose focus. You were determined. So you have to give this tip also, that you decide early and you stick to the plan like you did. Like you were there, you were focused and determined that you have to make it in this exam itself.
I think more than my ability to do it, it was my passion. Like I was very excited and very passionate about passionate about doing something before. So I was passionate all the time that I have to clear this because I have to pursue reproductive medicine. So
okay, so that every day you have to have the motivation to open the book for 1 whole year, or sometimes even more than that. That is important, to be able to decide and then to stick to the plan, right? You don't realize it because you were so determined, you had to do it. That 1 year went by easily for you because you were focused. There are students that lose focus, and I keep telling them that the determination which is there on the first day should be there on the last day also. So it was so nice talking with you, Dr. Devyani. So much to learn from all of the toppers. I teach and I learn. In the last 1 month, I've learned so much from all of you all. It is such a privilege to know all the talented students.
It's so nice to meet you, ma'am, in person and talk to you.
Same here, dear. The pleasure is same. Today has been such a nice day. I've been taking interviews and meeting all the lovely people. It's so nice. Makes me feel so proud. Thanks, Devyani. That is all the time that I needed from you. We'll stay in touch definitely.
Yes, ma'am. Thank you for.
Okay.